Hello everyone, I'm Dr. Mongkol Prangsiporn, Thai dentist from Bangkok. This is my case presentation to present female patients. She was 37 years old when she came to my practice last 5 years ago. She complained that her chewing is getting worse after she lost lower back teeth. She needs new lower molar teeth replacement. When we do clinical examination, we found tooth number 1213 is crossed by. Lower midline is shift to the right side around 1.5 millimeters from CR to CO position. We still found 1/7 extrusion, 1/8 is no opposing tooth. The upper front teeth and lower front teeth, they are mild crowded. And we found the constricted arc, especially at the anterior arc width zone or at the premolar area. Edentulous space and the tooth number 36, 47, and tooth number 37, it's dripped to the front. Her profiles look good. From dressing, the value close to the normal. At the diagnosis, the overjet overbite less than normal a little bit. We plan to use fast braces for orthodontic treatment. We hope to get fast treatment time with less complication in the adult case because we can control the crown and root torque starting from the first appointment, and we plan to finish it in around 6 to 10 months. We have planned with 2 single crown implant at the tooth number 36 and 47. We plan to place implant at the 47 area before braces treatment. With the area 36, we plan to open the space with the bracket first. So, pre-orthodontic treatment, I did 1/8 tooth extraction. I did 4/7 dental implant placement. For the orthodontic treatment with the fast braces system, they are the bracket starting from 5 to 5 only, both upper and lower. So that's why we use a buccal tool with lot prescription at the molar teeth area. When we start at the first day, we fix the upper and lower bracket. We add up the zinc phosphate cement on the top of the tooth number 46 and 37 for created the vertical clearance to unlock 1/2 and 1/3 crossbite. I fix the lingual button at the lingual surface of tooth number 13 and hold the fork elastic both sides to close the bite in to push the two upper front teeth to the labial direction. After a month, we can see tooth number 12 and 13, it's out from the crossbite, but we still need to put the force, push them more, and we change the direction of the elastic on right side a little bit from V shape to be the trapezoid shape like this. We cut down the cement turbo a little bit for make patients more convenience to cross her bite. We start to see the space is starting to be bigger. After 2 months, we can see from the X-ray that tooth number 37, the space has been opened and it's in the upright position. From the clinical examination, we see a lot of changes. You can see 1, 2, 1, 3, it's out of crossbite. We can see the upper and lower midline, it start to be in the same line. The space has been opened at the tooth number 36 edentulous space. So we plan with the implant placement at that times, I'll do flap surgery by making the clesso incision, spread it in the half length of keratinized tissue to be both buccal and lingual tissue in the fusures. I put the implants in, connect with the healing abutment. This called the non-submerged implantation. Add up with the sticky bone and cover with the CGF and close the wound. So after operations, we have 2 implants already, and now we can see the broader arc, both upper and lower jaw, and upper and lower teeth are in the good alignment. So we still wait and doing finishing step for orthodontic treatment. After 5 months, we found that everything is perfect. So we plan to take the braces off. In the same times, 2 implants has been healed around 10 weeks. So we have planned to take the braces off and take impression both implants at the same day of bracket removal. After a week, we can do the crowns and abutment on implants insertion. We insert abutment firstly tightening the screw, and after that we fix crowns on the abutment. This is the cement retained implants. You can see the nice result. This is the X-ray of tooth number 37. We can see the good bone on the meso side. Surrounded implant, we have a good surrounded bone too. When we check at the proximal or at the buccal side, this is her right side before treatment. We do intrusion here, and we have the new crowns implants after treatment. On the left side, we see the space between number 36 and number 26. After we upright, we can create bigger space and get the nice crown shape of 36 after treatment with a good biting. So after treatment around 5 to 6 months, we can get a nice outcome. Well alignment both upper and lower. The lower jaw shift to the normal position with the coincide midline between upper and lower midline. We can get the good crown implants on both sides of lower jaw. From the panoramic X-ray, you can see the good root parallels, including nice result of upright molar tooth number 37 with the good surrounded bone around the implants. One of key success is we use a good root torque control when we do the crowded teeth collection without failing of incisor teeth, because we start to use the bigger wire or like the square or rectangular wire in the slot, because we would like to reduce the play and we would like to create good root torque control. So after treatment, we can see the score or the value from the landmark. It's close to the beginning. We can compare both like this. You can see upper 1 to SN 108, 109. Interincisal angle 121, 122. It's not a big difference. We can see some changes, few millimeters changes at the IMPA, maybe because this is the tip in of lower anterior after crossbite collection that is shown the score of the axis change a little bit. We would like to do the cast analysis. The anterior arc width, it's increased from 35 to be 38, starting from the center of 1.4 to 2.4. The arc height is not changes. So It shows that we can control the good inclination of the upper incisor even though it is like a maybe malalignment in the beginning. We do another analysis for check the width of interincisor, intercanine, interpremolar, and intermolar. We can get a good result, no changes at the intermolar, but with the intercanine width, we can get increasing 4.5 millimeters. Thank you for your attention.